Hi, students. We are going to go through Chapter 4, Introduction to the Patient Record. So let's go ahead and start off here with the learning objectives. At the end of the chapter, you should be able to summarize the multiple uses of healthcare data, describe the categories of data collected and maintained by the healthcare providers. Welcome, students. Today I'm going to go through the essentials of health information management, textbook PowerPoint, Chapter 4. Introduction to the Patient Record. So with this, we have slide 1 of 2, the learning objectives. So with this, we are going to summarize multiple uses of healthcare data, categories of that data collected and maintained by healthcare providers. We're going to identify provider responsibilities for the patient record, distinguish between authorship, authentication of the patient health record, and then define acceptable authentication methods, distinguish between abbreviations allowed and not allowed for the use in the patient record. We will also discuss current process to amend that record, the flow of the patient information, distinguish among patient record formats, differentiate between primary and secondary sources, summarize retention laws, alternative storage methods, and summarize patient record completion. Okay, so the purpose of the patient record. So it does serve as a business record for a patient encounter. It contains documentation of all the healthcare services provided to a patient. It's a repository of that information that includes demographic. It discusses information that's found in the paper record and then addresses how the same information is found in electronic records. Okay, so let's go ahead and first talk about the ownership of the patient record. One thing to remember is that you as a patient, you own that information, okay? But the facility owns the physical record itself, whether that be paper or electronic. So again, you as the patient, you own the information, but the facility owns the physical electronic component of the record. So hospital inpatient. With this is somebody who's been 24 hours. That is considered an inpatient. One thing with the hospital outpatient record, keep in mind, a hospital outpatient record can be an ER record. Hospital outpatient can be somebody in observation, or hospital outpatient can be basically just as it states, same day surgery outpatient. Where a physician office record is when you actually go to see the physician, and that will be the record that they document your stay or your visit, I should say, at the physician office. Alternate care settings. This is going to be a little bit different. With that, we have a lot of different alternate care settings, which we'll talk about here at the end of this video. All right, one thing I want you to remember, the primary purpose of the patient record is continuity of care. This means documentation of the patient care services so that others who treat that patient, they have a source of treatment so they can base additional care and treatment. Also, the record is a communication tool. So one department can go ahead and read that record, and let's say another department pulls up, they need to look at the lab. So it's continuity of care. It's a communication tool between all those involved. The purpose, also slide 2, the paper electronic patient record has many purposes, but keep in mind only on goal documentation of patient care. Hospital and patient records have traditionally. So an increased number of healthcare services continue to be provided on outpatient and primary care basis. So the importance and volume of this information are increasing. So basically what this sums up to be that outpatient services are increasing a lot. And the reason is because it is cheaper for insurance companies, for hospitals to give that patient the outpatient setting, get them in, treat them, make sure they're stable, and get them out healthy. Regardless of the type of care provided, a healthcare facility patient records contain similar content. This means consent forms, different format features, all records contain patient identification. Okay, so I did talk about that alternate care facilities. This could be behavioral health, home health, hospice, outpatient, skilled nursing, and then other forms of care. Okay, so one thing here I want you to remember is demographic. What is that? It's patient identification. It's collected according to the facility policy. It includes the patient's name, other information such as the date of birth, place of birth, mother's maiden name, social security number, and so on. Now, information capture, this is the process of recording representations of human thought, perceptions, actions. You're documenting patient care as well, device generated information that's gathered, computed about a patient as part of healthcare. So have you ever went to the doctor? You are, let's say I went into acute care. And as I'm there, the doctor starts recording, what's wrong with me. So let's just do an example. The patient comes in with wheezing, cough. The doctor talks about that. The right lung does feel like it is a little bit full, and then the doctor states their clinical impression. The patient has acute asthmatic bronchitis. So they'll sit there and record that and talk into the information capture. Why a lot of times you could be sitting right in the room. So then we have report generation. This is the construction of a healthcare document, paper or digital. It consists of formatting or structuring that captured information. Okay, so secondary purposes of the patient record. These do not relate directly to patient care. Evaluation quality of patient care. You could provide third party payers, and when I'm talking about that, this is going to be insurance companies for reimbursement. This is all secondary purpose. Another thing would be legal interest of the patient, facility, and providers. And then the big one here, that data that you have is used in clinical research. We do for education, public policy making, facilities planning, and healthcare statistics. Okay, so let's go ahead and look at the different primary and secondary sources. So records that document patient care provided by healthcare professionals are considered primary sources of patient care. So different examples would be the original patient record, whether it's paper or electronic, x-rays, any scans, EKGs, and other documents of clinical findings. This could be lab reports also. Now, your secondary sources, this is very important that you know the difference between the two. Patient information contains data abstracted, selected from primary sources of patient care. This could be any committee minutes. This could be index and registers where they take just a little bit amount out of the primary source. And then incident reports. So an incident report, this collects information about a potentially compensable event, which is PCE, which is an accident or medical error that results in personal injury or loss of property. I'm sure everybody has had an incident report, whether it be health wise or non health wise. Couple examples, like if you were at work and let's say you slipped because there was some water on the floor and you hurt your shoulder. At that point, an incident report needs to be filled out about that you fell. Same thing, let's say you are working, not health related, and it's winter time and you're in the parking lot and you slip on some ice and you break your ankle, this also would be an incident report. Okay, so there is many types of different incident reports, and this basically is a secondary source for the patient record. Okay, I did kind of talk about this. The medical record is the property of the provider. This is governed by the federal and state laws. The patient, you, has the right to access its contents for review. So in addition, the provider has the option to maintain a record on its premises or in an appropriate off-site storage facility. So electronic health records, these are known as electronic medical records. They were previously known as the CPRs. They include electronic digital characters, signatures that are permanently stored using electronic media. The records are viewed on a monitor or possibly as a printout. So one thing to keep in mind that information in the medical record can be amended. Okay, so but as a patient, you would have to write a letter clarifying that information, which is then filed in the record. So let's say you viewed your record and they stated something, the patient is irrational. And you're like, I was not irrational that day. You just can't go in and change it. You have to go through the certain channels, protocols to go in and change that record. And usually they'll just put an amendment saying patient disagree with the documentation and go from there. They're not going to actually go in and change the original. Confidentiality of patient records. This is one of the most important responsibilities of health information practitioner is to safeguard that confidentiality. You don't want anybody to get in your record and go ahead and tell everybody else what is in your record. A lot of times you'll see this with movie stars that, somehow somebody got into their patient record, leaked it. This happens. Keep in mind, a lot of people will get fired over this. So, one thing to remember is that what you see at the facility stays at the facility. Non confidential information, this is just common knowledge. There is not a specific request by the patient to restrict disclosure, name of the patient. You can call in and verify if somebody's hospitalized or outpatient services and the date of services. Common knowledge. So legal requirements, state laws and regulations, they specify that healthcare institutions must keep medical records. There's no federal laws on medical records. You're going to have a lot of state laws. There are federal laws, regulations which apply if the institution wants to get reimbursed for the treatment of Medicare and Medicaid patients. So that's probably the biggest thing. Let's go ahead and distinguish between the two. So we don't have federal laws, but Medicare and Medicaid, they have their own rules. And if a facility doesn't follow those rules, they're not going to get paid. So that is why a lot of times you will see that people do follow the Medicare and Medicaid because they do want to get reimbursed for seeing that patient. Okay, hospital inpatient record. This documents care and treatment received by the patient admitted to the hospital. Hospital inpatient record can be maintained on paper, electronic, or a hybrid system, which is both paper and electronic. Now, the administrative data, which you'll have some mind tap on this, demographic, socioeconomic, and financial information. Your clinical is all the patient health information obtained throughout the treatment and care of the patient. Usually when you start here, you have during the nurse's station while an inpatient. This is where it all starts. The EHR has, okay, one thing I do want to go ahead and state with the EHR, you have bedside terminals, which is called point of care. And what that is, let's say you're a hospital inpatient, the nurse comes in or the doctor comes in, and they have a computer. And as they're asking you questions, they're typing it out or getting recorded. So that's point of care. They're writing things down as they see the patient. So another interesting fact is that a lot of the reasons that they're getting rid of, paper records is that a 6 to 8 day in the hospital accumulates 60 to 100 pages of paper. So that is crazy. So that's why it is just, a lot of it's going to electronic. Okay, so let's go ahead and talk about hospital outpatient. This is ambulatory care record. Ambulatory means as you can walk in. It documents services received by the patient who have not been admitted to the hospital overnight. This includes ancillary services as your labs, x-ray, emergency department services, outpatient or ambulatory surgery. So as I talked before, hospital outpatient has increased just because you're not in the hospital as long. You don't have the status as an inpatient. And the hospital, once again, it's going to be cheaper for the hospital because you're not staying overnight. And with that, it's going to be cheaper for the insurance company too. Now, the physician office record. This is when you go to see the physician, let's say for a urology appointment or internal medicine because a yearly physical. So the patient healthcare services received in a physician office, they're documented, of course, in the physician office record. Registration data is collected on each patient prior to the patient being seen or at the time of the patient's first visit. So while the content and format of the physician office records vary greatly from office to office, they both include administrative and clinical data. Okay, so then we have your alternate care. With this, as I stated before, there are similarities with the type of records. Once again, they all contain administrative and clinical data. And I talked about this. So behavioral health, this could be anything with mental health. Home health is where you are at home and you have a nurse or a CNA come in and see you to make sure that you're doing okay, check your vitals. Hospice, this is palliative care, usually end of life type care. Outpatient, and then you have skilled nursing. Once again, they all contain administrative and clinical data. This concludes this lecture. If you have any questions, please reach out.